What causes dizziness and fatigue? 9 possible causes. Dizziness is a word that describes the sensation of spinning while being off balance. To explain to your doctor exactly how you feel, you can use these more specific terms. 1. Disequilibrium is when you feel unsteady. 2. Lightheaded means you feel faint or woozy. 3. Vertigo is a spinning sensation when you aren't moving. Many different conditions can make you feel both dizzy and tired. Sometimes these symptoms are temporary, or they might come and go. If you often feel dizzy and tired, see your doctor for a diagnosis. Untreated dizziness and fatigue can cause a fall. It can also increase your risk of getting into an accident while driving. 1. Low blood sugar. Your body needs sugar, also known as glucose, for energy. When your blood sugar level drops, you can become dizzy, shaky, and tired. Low blood sugar is often a side effect of insulin and other drugs used to treat diabetes. These drugs lower blood sugar, but if the dose isn't right, your blood sugar can drop too much. You can also get hypoglycemia if you don't have diabetes. It can occur if you haven't eaten in a while or if you drink alcohol without eating. Other symptoms of low blood sugar are: 1. Fast heartbeat. 2. Sweating. 3. Shaking. 4. Hunger. 5. Irritability. 6. Confusion. 2. Low blood pressure. Blood pressure is the force of your blood pushing against blood vessel walls as it circulates through your body. When your blood pressure drops, you can have symptoms like dizziness or lightheadedness, and fatigue. Other symptoms include: 1. Nausea. 2. Thirst. 3. Blurred vision. 4. Fast and shallow breathing. 5. Pale, clammy skin. 6. Trouble concentrating. The following conditions can cause your blood pressure to drop: 1. Heart problems. 2. Medications. 3. Serious injury. 4. Dehydration. 5. Vitamin deficiencies. 3. Anemia. Red blood cells carry oxygen to all your organs and tissues. When you have anemia, your body doesn't have enough red blood cells, or these cells don't work well enough. A lack of oxygen can make you feel dizzy or tired. Other signs of anemia are: 1. Shortness of breath. 2. Weakness. 3. Fast or uneven heartbeat. 4. Headache. 5. Cold hands or feet. 6. Pale skin. 7. Chest pain. Bleeding, nutrient deficiencies, and bone marrow failure are all possible causes of anemia. 4. Migraine headaches. Migraines are intense, throbbing headaches that last from a few hours to a few days. Along with the headache, you may experience symptoms that include: 1. Vision changes, such as seeing flashing lights and colors. 2. Nausea and vomiting. 3. Sensitivity to light and sound. 4. Lightheadedness. 5. Fatigue. People who get migraines can experience dizziness and vertigo, even when they don't have a headache. The vertigo can last for a few minutes to a few hours. 5. Medications. Certain medicines can cause dizziness and fatigue as side effects. These include: 1. Antidepressants like fluoxetine, Prozac, and trazodone, Deseral. 2. Anti-seizure drugs such as Valproex, Depakote, gabapentin, Neurontin, Active-Pak with gabapentin, and pregabalin, Lyrica. 3. Blood pressure lowering drugs, such as ACE inhibitors, beta blockers, and diuretics. 4. Muscle relaxants such as cyclobenzaprine, Fexmad, Flexeril, and metaxalone, Scalaxin. 5. Sleeping pills such as diphenhydramine, Benadryl, Unisum, Somanex, Temazepam, Restoral, Ezopacolone, Lunesta, and Zolpidem, Ambien. If you're on one of these medicines and it's making you dizzy or tired, ask your doctor if you can lower the dose or switch to another drug. 6. Abnormal heart rhythms. Normally, your heart beats in a familiar, lub-dub, rhythm. When you have an irregular heartbeat, or arrhythmia, your heart beats too slow or too fast. It might also skip beats. Besides dizziness and fatigue, other symptoms of an arrhythmia include 1. Fainting. 2. Shortness of breath. 3. Chest pain. Your doctor can treat heart rhythm problems with drugs like blood thinners or blood pressure medicines. Avoid substances like caffeine, alcohol, and cold medicines. These things can make your heart go out of rhythm. 7. Chronic fatigue syndrome. Chronic fatigue syndrome, CFS, is a condition that causes overwhelming tiredness, even after you've slept well. Symptoms of CFS include dizziness and trouble keeping your balance. You might also have symptoms that include 1. Sleep problems. 2. Trouble remembering and concentrating. 3. Muscle or joint pain. 4. Headache. 5. Allergies and sensitivities to foods, medicines, or other substances. CFS can be hard to treat because it's different for everyone. Your doctor will treat your individual symptoms with therapies like medicine and counseling. 8. Vestibular neuronitis. An infection like a cold or the flu can inflame the vestibular nerve in your inner ear. This nerve sends sensory messages to your brain to keep you upright and balanced. Swelling of the vestibular nerve can cause dizziness and vertigo. You might also feel fatigued. Other symptoms of vestibular neuronitis include 1. Nausea and vomiting. 2. Trouble concentrating. 3. Blurred vision. A virus usually causes vestibular neuritis. Antibiotics won't help, but the dizziness and other symptoms should improve within a few days. 9. Dehydration. Dehydration is when your body doesn't have enough fluid. You can become dehydrated if you don't drink enough water. This is especially true while you're outside in hot weather or exercising. Symptoms of dehydration include 1. Dizziness. 2. Fatigue. 3. Little to no urine. 4. Confusion. These all are reasons of fatigue and dizziness. At the end, it is requested you to please subscribe our channel.